The changes in healthcare in the United States is one of the few developed countries with higher percent of private than public insurances. Many do not have insurances or are underinsured. States with universal insurance have lowest rate of uninsured. Three major causes for concern in the United States healthcare system compared to other industrialized countries. Number one, through America, healthcare is the next sophisticated. Americans are not the healthiest among the industrialized countries. Number two, Americans are more likely to have unmet health needs due to lack of accessibility. Three, there are inequalities in the American healthcare system that lead to significant disparities in access and care, including inability to pay for healthcare. The United States has the most expensive healthcare system in the world. My interviewee number one, Shantae Lewis, age 25, says healthcare is obtained through her job and paid for through her job. All her healthcare is through Kaiser, and she loves her providers, including pediatrics, since she started using Kaiser. The changes that she has seen is the increase in healthcare. The treatment of care is the same. Interviewee number two, Ebony Horace, age 39 or age 40. Healthcare paid through by their employee benefits or government assist Medicaid. Receive healthcare Kaiser and Sutter. She loves her providers, especially her OBGYN and pediatrics for kids. Healthcare is obscured and benefits those that can afford it is limited to those that need it. Working in the insurance department in Texas, benefits were denied to patients that had pre-existing issues or those that needed it and required medical review. This could sometimes be political and based on person's survival ratio or if they get help or not. Treatment is no longer affordable. Employers offer benefits but often change packages that employers don't realize they have no coverage for certain things, so they don't know what they were signing up for. Because it's unaffordable, more and more people opt out of preventable medical checkups and other parts that are not free. They need to meet their minimal deductible and co-insurance amounts. With Obamacare, at least everyone was mandated to have insurances which required checkups and gave reassurance that they wouldn't have a bill exceeding the amount based home pay. Healthcare is worse. Now medicines are becoming street accessible with FDA compliance and people are getting procedures at home. Cosmetic, abortions, etc. People are relying on WebMD. Resources are waiting until they are sick. Marijuana has actually helped the medical industry, making it legal and taking the taxes and revenue stream in the medical field. My third interviewee was Jesse Fambro, age 72, retired. Healthcare has changed over the years. The pricing of medications have rose. If you have Medicare, you also need a supplement to cover the overages. Medicare don't cover most of what elders need and is the bare minimum. We need a supplemental coverage, but it's hard since you can't afford it if you're on SSI or retirement. Most insurances don't cover pre-existing conditions. So any history of blood pressure, heart conditions, diabetes, obesity will automatically reject coverage. It's not disclosed. The changes that she has seen is on birth control. There are so many options to choose from. Example, pills, patch, or shots. and also uterine devices. When we were young, they didn't have those back in the days. The technology is more advanced. You can now make appointments online or look up any procedures that you may have done, like blood test or mammogram, any ultrasounds, any test that the doctor had ordered for you. You can see online. She says her treatment is still the same except for co-pays have gone up in premiums also. Thank you, and that's my healthcare interviewee request.